Hello, my name is Usama and I will discuss in this section Autism Spectrum Disorder. You can follow with me in the Pediatric Board Study Guide, Behavioral Mental Issues and Neurodevelopmental Disorders from page 38 to 39, Autistic Disorders. My objectives in this presentation is to discuss causes of Autism Spectrum Disorder, differential diagnosis and management of ASD, and management of co-occurring mental health disorders. The causes of autism spectrum are unknown. Examples of hypotheses to cause of autism: obstetric complications, for example, intrauterine exposure to thalidomide or valproic acid, or intrauterine infections, genetic diseases, and toxic exposure. Syndromes associated with autism spectrum disorder. If you have a child with autism spectrum disorder plus intellectual disability, macrocephaly, large jaw, large hands, and macroorchidism, and you order genetic test and is positive for CGG triplet more than 200 repeats, this is Fragile X syndrome. Very important to know that these classic features appear later in life. Initially in the first year you will have a non-specific developmental delay like speech and motor delay. Another syndrome presents with autistic spectrum disorder and ash leaf spots, adenoma sebaceum, chagrin patches, tumors, seizures, and intellectual disability is tuberous sclerosis. Coffee ole spots, neurofibromas, leash nodules, sphenoid dysplasia, or tibial pseudoarthrosis. This is neurofibromatosis, also can be associated with ASD. MMR vaccine versus autism. The public fear of MMR vaccine causing autism based on the article published by Andrew Wakefield in 1998. This article is biased and inappropriate recruitment and later was retracted. So there is no link between MMR vaccine and autism. So it is important for pediatricians to recommend the childhood immunization to parents without fear of causing autism and related conditions. Thimerosal versus autism. Thimerosal is a type of mercury antiseptic added to multi-dose vial vaccine to prevent the growth of bacteria and fungi. Thimerosal is broken in the body to ethyl mercury, and ethyl mercury cleared quickly from the body and less likely to cause any harm. If you compare ethyl mercury to methyl mercury, which is high in certain type of fish, this type of mercury, methyl mercury, stays in the body and can be toxic to people. Because of public fear of thimerosal, the pharmaceutical companies, they make single dose vial free of thimerosal since 2001. So there is no fear, or there is no reason for fear to give vaccination to the children, and there is no link between thimerosal and autism. Red flags of autism spectrum disorder: no babbling or fewer vocalizations with a limited range of sounds, no pointing, no gesturing, does not smile at people, no single words by 16 months or speech delay, no spontaneous two-word phrases by 24 months. Any loss of skills is serious, so any signs of loss of language or social skills, lack of response to name, poor coordination of eye gaze with other communicative behavior, for example, gestures, or poor eye contact in general, lack of spontaneous imitation, failure to follow another person's point towards an object or event of interest, lack of shared enjoyment. Is my child truly autistic? Parents always anxious about this diagnosis, so it is very important to take our time and carefully evaluate the child before giving the diagnosis of autism spectrum disorder. It is critical to know that childhood language disorders are much more common than autism spectrum disorder, and speech delay by itself does not mean autism. It is also important to change our perception and public perception about autism spectrum disorder. Most affected children with autism spectrum disorder, 62%, have intellectual abilities in the normal range with IQ more than 70. So ASD with normal IQ, they are much more common than ASD with abnormal IQ, so they can be very smart. We have to be familiar with non-specific behaviors that can be associated with or without autism spectrum disorder. For example, arranging objects until they satisfy some sensory perceptual criteria for being just right. They keep arranging again and again. Arm flapping, waving or shaking, head nodding, fluttering of fingers in front of the face. Prefers the same household schedule or routine every day, repeats certain actions over and over, repeats the same movie over and over again and again. Has strong preferences for certain foods, acts out the same thing over and over in pretend play. So all these behaviors can be normal in 60% of the cases. There is a big difference between specific language impairment and autism spectrum disorder. In case of a specific language impairment, there is a strong interest, little interest in case of ASD. Joint attention means the two individuals share attention to the same object. And here, in case of ASD, limited or absent joint attention. Imitation, very limited imitation, pretending, no symbolic play, no restricted, repetitive patterns of behavior, interest, or activities. Here in ASD, attachment to odd objects. In case of a specific language impairment, the child will be frustrated because of lack of understanding or inability to communicate. In case of ASD, stereotype behavior and unusual response to stimuli. Coexisting conditions that can be confused with autism spectrum disorder. For example, if you have a child with gaze avoidance or poor eye contact, atypical emotional reactivity, very important to evaluate the vision and the hearing. So visual impairment can cause that, hearing impairment can cause that. Extreme shyness can be confused with this case. Non-autistic communication disorder, severe cognitive delay. How to make the diagnosis of autism spectrum disorder? Unfortunately, biologic markers for autism do not yet exist. So there is no blood test to confirm if the child is having autism or not. The first initial step in making the diagnosis of autism spectrum disorder starts by screening. Questionnaires and answers, and the parents will answer the questions. Infant and toddler checklist ITC between 9 and 24 months. Modified checklist for autism in toddlers, or well known as MCHAT, is between 16 and 30 months. It's not reliable after 3 years of age. It is critical for all children to have in their physical at 18 months and 24 months MCHAT. This is AAP guideline. A childhood autism screening test between 4 and 11 years. If the screening test is suggestive of autism spectrum disorder, the next step is formal evaluation, and this is usually conducted by multidisciplinary team. Includes child psychologist, speech language pathologist, developmental pediatrician, child psychiatrist, education specialist. The diagnosis of autism spectrum disorder can be successfully made in the pediatric office with careful history from parents, detailed physical examination including neurological examination looking for any neurological abnormalities such as microcephaly, hypotonia, dysmorphic features, examining the skin for ash leaves or cafe au lait spots, developmental screening using for example ASQ for speech, language, motor, social and play skills, questionnaires, structured questionnaires and rating forms completed by adults familiar with the child. In general, any child with a speech delay, with or without autism spectrum disorder, they have to be screened for vision or hearing impairment even if the parents they believe they are normal. Indications for genetic testing: if the child has intellectual disability cannot be excluded. There is a family history of fragile X or undiagnosed mental retardation, dysmorphic features. EEG if any type of seizure is suspected. MRI not routinely recommended unless there is a specific indications, for example cases of tuberous sclerosis or neurofibromatosis. Schools plays a very important role in assessment of children with autism spectrum disorder. For children 3 years and older, refer to special education department at local school. Assessment team may include speech language pathologist, physical therapist, occupational therapist. So the testing or the services provided in most of the schools is Individuals with Disability Education Act, Autism Diagnostic Observation Schedule EDOS, Autism Diagnostic Interview Revised or EDIR. Having multiple therapists and evaluations helps clarify the diagnosis and the treatment planning. To make the diagnosis of autism spectrum disorder, the child must meet the criteria of DSM-5. Not all children with autism spectrum disorder are the same. We have a classification level 1, level 2, level 3 according to social communication restricted repetitive behaviors. If you have mild impairment requiring support, moderate impairment requiring substantial support, if you have severe impairment requiring very substantial support. Families look initially to pediatrician for guidance to make treatment and education decision. So the treatment burden falls in pediatric clinicians because you may not have a child psychiatrist, you may not have developmental specialist around or available for a sooner appointment. So it's very important to be the advocate of your patient. Management of autism spectrum disorder: speech and language therapy should be started as soon as possible with no delay. There is no need to wait for the result of the hearing test, vision test for formal diagnosis of autism spectrum disorder. the diagnosis of speech delay is enough to be qualified for speech therapy. In children less than 3, refer to early childhood intervention to improve verbal and nonverbal communication, occupational therapy to improve fine motor deficits and improve academic and self-care skills. Evidence-based treatment in management of autism spectrum disorder. You can prescribe to your patients applied behavioral analysis to increase socially appropriate behavior, decrease the severity and or emergence of challenging behaviors, and this will result in improvements in communication, social relatedness, decreasing repetitive behaviors. Half of all children with ASD suffer from anxiety and phobias. How to screen for that? You can use SPIN's Children's Anxiety Scale. Very important to know that medication is rarely required in clinical practice unless the anxiety is debilitating. Second most common co-occurring condition with ASD is obsessive compulsive disorder. And signs of that: unwillingness to change routines, may limit their ability to interact socially. How to screen for that? Simply ask the parents about these symptoms. Very important to know that SSRI used in children with autism found no evidence of effect for either anxiety or obsessive compulsive disorder. Attention deficit hyperactivity disorder is a common co-occurring condition in children with autism spectrum disorder. Screening and follow-up using Vanderbilt form. Management is with either stimulants or non-stimulants. Examples of stimulants: methylphenidates, amphetamine salts; non-stimulants: atomoxetine or strattera, guanfacine or clonidine. The point I would like to make here: that children with ASD, they can have adverse effects and irritability at lower doses than children without ASD. So in this case, start with a lower dose, start low and go slow. Children with autism are likely to get teased and taunted or bullied. This can cause social withdrawal, sadness, crying spells, and depression, and they may find it difficult to fit in, and this may require medical treatment and counseling. Disruptive behavior is another co-occurring condition with autism spectrum disorder. This behavior may escalate to aggression. Management behavioral therapy, they may need to be on risperidone or aripiprazole or what is well known as Abilify. Complementary and alternative medicine, parents they may like to try, if it's safe and effective, recommend. Examples are gluten-free and casein-free diets, vitamin B6, magnesium, vitamin C, omegas, and combined hypervitamin therapies. Another example of CAM is sensory integration therapy. This is usually combined with occupational therapy. This will result in increased attention to auditory input, improved social behavior, increased interest in communication, and better eye contact. Another type of CAM is swimming with dolphins and horseback riding. So generally, if CAM is safe and effective, recommend it to parents. If a CAM therapy is unsafe and not effective, then advise against. Let us summarize this presentation. To make the diagnosis of autism spectrum disorder, it may take several months. So if you have a child with suspected autism spectrum disorder, provide a structured questionnaire and rating. If the score is suggestive of autism spectrum disorder in the child less than 3 years of age, perform ideology and vision testing. Refer to ECI, early childhood intervention, for speech therapy and occupational therapy, and monitor progress. If the child with suspected autism spectrum disorder is more than 3 years of age, provide hearing and vision evaluation. Refer to a local school for evaluation and testing. The testing and evaluation may include Individual with Disability Education Act, Autism Diagnostic Observation Schedule, or EDIR, which is Autism Diagnostic Interview Revised. Provide therapy and monitor progress. If history and physical exam are suggestive of underlying condition, provide testing and manage. Do not delay therapies for a final diagnosis. Monitoring the response to appropriate interventions may improve the accuracy of diagnosis, especially in very young children. For example, if you have an 18-month-old with suspected autism spectrum disorder, this child received speech therapy and occupational therapy, rapid response to therapy, milestones are normal for age at 2-year well visit, for example, and the child does not meet the criteria of autism spectrum disorder anymore. Autism is unlikely, just reassure the parents. Some children may have not been diagnosed with autism spectrum disorder and are labeled with co-occurring condition of autism spectrum disorder like ADHD, aggressiveness, mood disturbance, learning disorders, and during school, the diagnosis will be established as autism spectrum disorder. Alternatively, a child may have been diagnosed as having autism spectrum disorder when in fact another disorder may explain the reason for their symptoms. Another child may have been diagnosed with autism spectrum disorder, then no longer fit autism spectrum disorder criteria over time, naturally or as a result of therapy. Links to ASD screening tools you can use in your clinic, all the links are provided below. This is the end of this presentation. Thank you for listening. This video is only for educational purpose and not intended to direct care of any specific patient. Please consult your physician or the physician of your child for the correct diagnosis and the proper treatment. None of my videos can be superior or an alternative for the opinion of an experienced and licensed healthcare professional. Thank you again.